Conscious Bites, Milk to Solids, Part 14.
Is there such a thing as silent reflux?
Silent reflux is medically known as aspiration. It is when the stomach contents not only flow into the esophagus but also into the throat or the larynx and pharynx. Babies do not show any signs of regurgitation or of being sick, but may appear to choke or cough without having a cold. Babies show signs of being in pain, especially when not upright, and may have a persistent cough. Aspiration can happen at any time. It can occur during the day or at night when your baby is sleeping. Silent reflux or aspiration must be diagnosed by a paediatrician who have the skills and expertise. The treatment of silent reflux or aspiration is the same as gastrointestinal reflux disease or GORD. Babies who are older than 6 months are encouraged to have more solids in their diet rather than only milk to reduce the regurgitation and reflux. And some babies may be encouraged to start the introduction of solids from 17 weeks to reduce the regurgitation and reflux.
How is vomiting different from reflux?
Vomiting is when your baby forcefully expels the contents of their stomach through their mouth, and often there is a lot more compared to reflux. Vomiting can be frightening for you and your baby as they are more likely to cry. Vomiting can be a result of motion sickness, indigestion, prolonged bouts of crying, or triggered by a coughing reflex, and usually subsides after 6 hours to 24 hours after it starts. Your baby shouldn't need any particular treatment apart from drinking plenty to ensure they stay hydrated. The most common cause of vomiting in children and babies is gastroenteritis. It is an infection of the gut, usually caused by a virus or bacteria, which also causes diarrhea. The symptoms can be unpleasant, but your child will usually start to feel better after a few days. Persistent vomiting can sometimes cause your child to become severely dehydrated, and occasionally it can be a sign of something more serious, so keep a close eye on them and contact your GP immediately if you're worried. If you're breastfeeding or giving them milk feeds, continue to do so to keep them well hydrated. You can ask your GP or pharmacist whether you should give your baby oral rehydration solution. Oral rehydration is a powder that you can make into a drink. It contains sugar and salts to help replace the water and salts lost through vomiting and diarrhea. Children who are vomiting should keep taking small sips of clear fluid such as water or clear broth. Fruit juices and fizzy drinks should be avoided until they're feeling better. If they're not dehydrated and haven't lost their appetite, then it's fine for your child to eat solid foods as normal.
What about projectile vomiting?
It's a frequent forceful projectile vomiting which happens when the pyloric sphincter valve is blocked. Often happens in babies up to 2 months old and needs minor surgery. Some babies can experience a one-off projectile vomit. Often this is not of concern.
Miss Dietitian, can you explain in more detail about milk allergy?
Hi, I'm Miss Dietitian from Conscious Bites. Hope you enjoyed this episode. Please leave comments below and don't forget to subscribe. Follow us on Facebook, Instagram and Twitter. For more information you can email us or check out our website. Bye!